Good morning, student. This is Dr. Ritu. Today, a topic of discussion is about anti-lipidemic agent. We will discuss them in detail. Now, see what is relevance of this topic. In your exam, it will be covered in your paper as a long question or maybe as a short note. At objective level, you should know what is lipidemia, their chemistry, and how this lipidemia causes cardiovascular disease. And at objective level, we discuss antilipidemic agents, their pharmacology, classification, and mechanism of action. So let's begin. What is lipidemia? Lipidemia is the presence of lipid in the blood. Okay. So three forms of lipid present into the blood, that is cholesterol, triglyceride, and phospholipids. The term dyslipidemia is used to describe abnormalities in lipid, primarily cholesterol and triglyceride. So in this slide, we show two arteries images. In the first artery images, this is a normal artery. And what is the function of artery? Anyone can define what is the function of artery? What is the function of artery?
मैम आर्टरीज में जो इम्प्योर जो हार्ट से बॉडी पार्ट्स के लिए ब्लड जाता है ऑक्सीजन रिच ब्लड
That is a pure blood, right, Priyanshu?
Yes, ma'am.
Okay. So the function of the artery is to carry oxygen-rich blood to heart and other parts of body. So this is a normal artery. But when the lipid are deposited in the artery, this deposition is made up of cholesterol, triglyceride. This deposition is made up of cholesterol, triglycerides, and other substances found in the blood, which limit the flow of oxygen-rich blood to lungs and other parts of body, which in turn increase significant risk of heart attack and stroke. So when the lipids are deposited in the artery wall, it may causes heart related problem. It may causes cardiovascular disease. Okay, so it is clear to everyone? This is clear to everyone? Okay, so the main problem of the lipid deposit into the artery wall, that is the problem is related to the heart attack, and also it may causes various cardiovascular disease. Now we discuss the three form of lipid, that is cholesterol, triglyceride, and phospholipids. So these are the three lipids which are responsible to adhere on the wall of the artery. So the first is cholesterol. This is the cholesterol. It is the structure of cholesterol. This cholesterol is necessary for the synthesis of bioacid, steroid hormone, and to maintaining integrity of the cell. And the second lipid component, that is triglyceride, these are composed of glycerol. These are composed of glycerol and three fatty acid chain. These are three fatty acid chain and components of glycerol. Okay, so triglyceride that can be stored throughout the body and it provide energy to our body. Okay, so this is the role of triglyceride in body. The third component that is called phospholipids. The third component related to deposition of lipid, that is phospholipids. So phospholipids are major component of all cell membrane. It is a major component of all cell membrane and function as emulsifier. This phospholipid function as emulsifier. Now, because these lipids are insoluble in blood plasma, they have to be transported throughout the body in a protein capsules. They are transported throughout the body in a protein capsules, and this protein capsule is called lipoprotein. So this protein capsule is a lipoprotein. It is a lipoprotein. Is a lipoprotein. Okay, so this lipoprotein consists of cholesterol and triglyceride. So this cholesterol and triglyceride in the lipoprotein. So this lipoprotein consists of a hydrophobic core. This is a hydrophobic core, and it is made of cholesterol and triglyceride. Okay, and this core is surrounded by a hydrophilic cell made up of phospholipid and apolipoprotein. So this lipoprotein is a combination of two groups, that is hydrophilic group and hydrophobic group. So hydrophobic group consists of cholesterol and triglyceride, and the hydrophilic group consists of phospholipids and apolipoprotein. Okay, it is clear to everyone? This is clear? Any doubt regarding this? Any question regarding this structure? Yes, Priyanshu? Okay. Now we continue this this lipoprotein. Okay. So amount of cholesterol carried by different lipoprotein in your blood. So it is divided into 5 types. That is, first, chylomicron. Second is VLDL. VLDL means very low density lipoprotein. VLDL is very low density lipoprotein. The third is component of lipoprotein, that is LDL. So LDL is a lipoprotein, that is LDL low lipoprotein. Okay, so this is a low level of lipoprotein, and the third and the last component of this lipoprotein is HDL, so high level of lipoprotein. So these are the 5 components of lipoprotein in our blood. So first is chylomicron. So chylomicron are synthesized in the intestine. This chylomicron lipoproteins are synthesized in the intestine part and transport dietary triglycerol to skeletal muscles and adipose tissue, and dietary cholesterol to the liver. So these chylomicron basically synthesized into the intestine, and this help to transport triglycerol into the skeletal muscles and cholesterol into the liver. Okay, so this is a function of chylomicron. The second is, that is, very density lipoprotein. So very low density lipoprotein are synthesized in the liver and transported triglycerol. So these triglycerol, cholesterol, these are the main lipid component that is responsible to deposit into the arteries. So this very low density lipoprotein are synthesized in the liver and transport triglycerol, cholesterol and phospholipid to other tissue. Okay, this is clear to everyone. Next is low density lipoprotein. This is a low density lipoprotein. So low density lipoprotein, when the very low density lipoprotein transformed into transformed into low density lipoprotein, and this low density lipoprotein transfer cholesterol to cell. So this low density lipoprotein, after conversion from the very low density lipoprotein, they enter into the cell, they transfer to the cell. Okay, so this is a low density lipoprotein. And the last component, that is high density lipoproteins. So high density lipoproteins are synthesized in the blood and extract cholesterol from cells. So this high density lipoprotein help to extract cholesterol level from cell membrane, but the low density lipoprotein help to deposit the cholesterol into the cell, but high density lipoprotein help to extract cholesterol from the cell membrane and converting it into cholesterol ester. So this is clear to everyone. So in the structure of chylomicron, this is the yellow dot represent the cholesterol level. So, and this is the blue area represent the phospholipids. So in the chylomicron structure is small amount of cholesterol are present, and this is covered by the phospholipids membrane. So this is the phospholipids membrane. Okay, and this represent the proteins. So this is the protein, and in the structure of very low density lipoproteins, in the structure of very low density lipoproteins, in the middle, the cholesterol level is increases, and the protein level also increases, and this is a phospholipids membrane. So covering of this is a phospholipid membrane, and it is entered to the adipose tissues, and in the adipose tissue it is converted, this VLDL converted into the low density lipoprotein. So in the structure of low density lipoproteins, that is formation of triglycerides. Okay, it is clear into the image, the formation of triglyceride, and it is covered with the help of protein and small amount of phospholipids. Okay, so after that this LDL is entered into the other tissues, and this enter into the other tissues. So in the other tissues it converted into the high density lipoproteins, formation of high density lipoprotein. So in the structure of high density lipoproteins, this is the in the middle part the triglycerides, but in the few amounts, and this is surrounded by the protein and phospholipids membrane. Okay, it is clear to everyone. This four different type of lipoprotein in your blood help to generate the synthesis of the lipid in your blood, and these lipids, when they are deposited into the artery wall, they may causes the increase the increased level of lipid into the blood, and may causes heart attack and other cardiovascular disease. Okay, it is clear to everyone? This is clear? Have you any doubt? Yes, Sujita? Okay. Now we discuss, that is LDL. So this LDL is low density lipoprotein. This LDL cholesterol is very important in the creation of cell wall. In the initial form, the low density lipoprotein cholesterol is very important in the creation of cell wall and hormones, digestive juice. So this low density lipoprotein is needed for a healthy body. So in the healthy body, the synthesis of cell wall, hormone, digestive juice, the concentration of low density lipoprotein is required. But unfortunately, the low density lipoprotein is also known as bad cholesterol. Why? We call this LDL is a bad cholesterol because when LDL means, what is LDL? Yes?
Low density lipoprotein.
Yes, right, Priyanshu. That is LDL is a low density lipoprotein. So when LDL level is high, it can start to deposit on the wall of the arteries. And in the previous images, this is the deposition of LDL. This is the deposition of LDL, that is low density lipoprotein into the wall of the artery. Okay, so this deposition into the wall of the arteries blocking the natural flow of blood and leaving you at severe risk for heart attack and stroke. Okay, so it may causes many cardiovascular disease when the lipid are deposited into the artery wall, basically in the form of low density lipoprotein. So low density lipoprotein cholesterol is very important in normal functioning. In normal functioning, the low density lipoprotein is very important in the creation of cell wall, hormone and digestive juice. But this lipid low density lipoprotein, also known as bad cholesterol, because these form of cholesterol are deposited into the artery walls and they block the flow of the blood and leaving you at a severe risk for heart attack and stroke. Okay, the second important constituent of lipid of cholesterol, that is high density lipoprotein. So this high density lipoproteins, this is also called good cholesterol. This HDL is also called good cholesterol because it carries cholesterol away from the tissue to the liver. The function of this HDL, it carries cholesterol away from the tissue to the liver and lowering blood cholesterol levels, because basically the main function of the HDL is to synthesize in the blood. This HDL is the high density lipoproteins are synthesized in the blood and extract cholesterol level from cell membrane. So the concentration of the cholesterol level in the cell membrane is decreases because the increased amount of cholesterol are extracted from these cells with the help of HDL. So that's why this HDL help to convert this extra cholesterol level into the cholesterol ester. Okay, so this HDL is called good cholesterol because it carries cholesterol away from the tissue to the liver and lowering blood cholesterol level. Okay, so high lipid is a high HDL level are associated with lowered risk of cardiovascular disease. Okay, so it is clear to everyone that is HDL is a bad cholesterol and LDL is a bad cholesterol and HDL is a good cholesterol. So what is the reason behind this? It is clear to everyone. This is clear. Have you any doubt regarding HDL or LDL? Have you any doubt? Okay, yes. Okay, so now we discuss the antilipidemic agents. So what is antilipidemic agent? Okay, so antilipidemic agents are the drug which act against the lipidemia. So lipid lowering agent used for controlling high cholesterol and triglyceride level in the blood is called antilipidemic agent. So antilipidemic means they act against the lipidemia condition. So they decrease the lipid level, into the blood and control the lipid into the blood and prevent this deposition of lipid into the artery wall. So main definition of the antilipidemic agents are an agent that reduce plasma lipid such as cholesterol or low density lipoprotein. So these agents basically reduce the lipid level. So lipid in the form of cholesterol are present into the blood. So these drugs reduce the cholesterol level or low density lipoprotein, because this low density lipoprotein is the main causes behind the deposition of the lipids into the artery wall. and acting systematically or locally at the intestine part to decrease fat digestion, absorption, production, and accumulation in the plasma and reducing atherosclerosis. So atherosclerosis, in this the lipid is deposit into the artery wall, and this condition is called atherosclerosis. Okay, this is clear to everyone. The definition is clear regarding antilipidemic agents. Now discuss the classification. So what is the classification? What is the classification of antilipidemic agents? So the first category of this classification, it is called HMG coenzyme A reductase inhibitor, and it is also called statin. This is also called statin, and HMG is a hydroxymethyl. H is a hydroxy, M is a methyl, and G is a gluteryl, and this is a coenzyme. Okay, so HMG coenzyme A reductase inhibitor, also called statin, and the example of this category, the example of drug is lovastatin. Lovastatin. Okay, so lovastatin is the drug in the category of HMG coenzyme A reductase inhibitor. The second category, that is called fibric acid derivative. So fibric acid derivative, in this category the drug is clofibrate. So clofibrate is the drug in the category of fibric acid derivative. The next category is niacin. Are you familiar with this term, niacin? What is niacin? Or nicotinic acid, what is niacin? Are you familiar with this term, niacin? Yes? Yes, Priyanshu? Shivani? Yes? What is niacin? Can unmute and ask. And
Vitamin B3.
okay. So niacin is a vitamin B3, nicotinic, also called nicotinic acid. So this is the niacin drug. It is also used to lowering the lipid level into the blood. The next category of classification, that is bile acid binding resin. Bile acid binding resin, the example of drug is cholestyramine. So cholestyramine is a drug in the category of bile acid binding resin. Okay, so this is the classification of antilipidemic agents. Okay, now we discuss the HMG coenzyme A. HMG is what is HMG? Yes, HMG. What is HMG? Yes, anybody? Okay, so HMG is a hydroxy methyl gluteryl coenzyme A. Okay, this is the full form of HMG. Okay, so we discussed the HMG coenzyme A reductase inhibitor. Okay, so this is the mechanism of action. This is the mechanism of action of HMG coenzyme A reductase inhibitor drugs. So this is the mode of action. Okay, yeah, or mechanism of action. This is mode of action. Okay, so in the liver cell, HMG CoA reductase convert this HMG CoA reductase. This is the enzyme. So this enzyme convert HMG coenzyme A to mevalonic acid. It convert this HMG into mevalonic acid. Okay, clear? So the mevalonic acid, this mevalonic acid is a cholesterol precursor. So this mevalonic acid is a cholesterol precursor. And this is a rate limiting steps. So by inhibiting the enzyme, this enzyme, sterin, that is the drug, sterin, that is also called HMG coenzyme A reductase inhibitor. So HMG coenzyme A reductase inhibitor drug effectively reduce concentration of cholesterol in the liver. So they decrease the concentration of the cholesterol into the liver. Okay, it is clear to everyone. Now liver cell reduce the level of cholesterol production, and begin to compensate by synthesizing more low density lipoprotein receptor. So this is the low density lipoprotein receptor. These are the receptors. These are the lipoprotein, that is lipoprotein receptor, low receptor, which in turn bind to low density lipoprotein, these receptor bind to low density lipoprotein. So they decrease the level of the cholesterol in the cell and leads to decrease secretion of very low density lipoproteins. And this receptor, that is called low density lipoprotein receptor, these bind this low density lipoprotein with receptor, and this receptor leads to secrete very low density lipoprotein. So this very low density lipoprotein, which also contribute to lowering the level of triglyceride. This also help to contribute the lowering the level of the triglyceride. Lastly, these HMG coenzyme A reductase inhibitor also may increase the HDL level by different mechanism. HDL level, that is high density lipoprotein level, by different mechanism. And this facilitate increased clearance of low density lipoprotein from the bloodstream and to subsequent reduction in circulating low density lipoprotein level by 20 to 55%. So these drugs help to increase the HDL level by different mechanism. Example of drug which belong to this class of this coenzyme A reductase inhibitor, that is lobestrin. So lobestrin act by inhibiting the enzyme, that is HMG coenzyme A reductase inhibitor into the liver cell, and this enzyme, when inhibited, not form the mevalonic acid, and when the mevalonic acid is not formed, cholesterol level is not increases into the liver cells. So that's the drug decrease the lipid level into the bloods, and it act as a antilipidemic agent. Okay, this is clear to everyone? This is clear? Have you any doubt regarding this anti-lipidemic agents, that is HMG coenzyme A reductase inhibitor? Okay, have you any doubt? So any question? In case you have any question, you can unmute and ask question. Yes? Have you any doubt regarding this topic?
No, ma'am, it's clear.
Okay. Now I end the session.